Hi everyone, this is Dr. Stefan. In this video, I'd like to discuss a comment that I received on my channel about COPD and inhaler treatment in COPD and how sometimes people are terrified about taking inhalers. So let me read the comment out to you, and then I'll provide a little bit of an opinion of what I think might be going on here. Obviously, what I'm saying to you in these videos, I'm not your doctor, okay, first of all. So I don't know your background. I don't know a lot of details about your case. So when I read out a comment and try to reply to that comment, what I'm saying is for general information. It's not medical advice in your case. So if you want medical advice because you're feeling unwell, please see your doctor as soon as possible. That's the only way to get concrete advice and treatment. So that being said, let me read out the comment to you a little bit. So I was diagnosed with COPD 2 years ago and given Spiriva 2 puffs a day, Symbicort 2 puffs twice a day, and Ventolin when needed. But I was terrified, this is why I underlined this, of using them. After taking the Spiriva, I felt worse, so I stopped, but about 18 months after, probably, my husband finally convinced me to try taking the Spiriva, and I did today, but I feel like it increased my shortness of breath. I'm scared and struggling. My doctor just expects me to take it, but I feel worse. Is this normal? Right, so thank you very much for the comment. It's a really, really good comment because a lot of people actually struggle with these sort of issues, especially when they are diagnosed with a chest condition. They need to go on inhalers because that's the treatment that we use. But it looks a little bit unnatural to take an inhaler. It's a fairly complicated device. You need to inhale it. You don't know whether it's going to help. You feel that when you inhale something, you might have a breathing attack or something like that. So there's a lot of mental blockages around the use of inhalers, and there's a lot of stigma, I think, associated with it as well. And people don't want to be seen using inhalers as well. That's something that we tend to hide. So there's a lot of these sort of psychological issues around inhaler use, which I think are very, very important to deal with. And I want to address it a little bit in this video and then provide some advice about what might be going on, because I do admit that inhalers are not necessarily for everyone. I'm not saying that inhalers are perfect. Of course, you know, some people may find some inhalers very good, some other inhalers not so good for their case. But generally, most people can find some inhaler device that works in their case and actually helps them breathe better, which is their purpose. Now, in the case of COPD, right? So COPD, chronic obstructive pulmonary disease. In COPD, basically, we are using inhalers with the goal of trying to keep the airways open for as long as possible. So you can imagine that the airways are affected by the COPD. They sort of lose their elasticity a little bit, and the muscles sort of constrict because there can be a little bit of inflammation. There's a lot of irritation from maybe years of smoking. There's a little bit of damage to the airways. So what we're trying to do with the inhalers is basically trying to dilate the airways. So we give bronchodilators. This is what we are giving. Now, the bronchodilators themselves, they can be short-acting or long-acting. So I'm giving you this sort of background just to understand what the inhalers are doing. So the short-acting inhalers are things like Ventolin. So Ventolin is a short-acting bronchodilator. It just dilates the airways, but its action only lasts for about 4 to 6 hours. After that, the airways sort of come back to their natural state. So the Ventolin is not necessarily a long-term treatment. We use it because it acts very quickly. So we take the Ventolin if we need to really get relief for our breathing very quickly in an airways disease. But then you have the other inhalers, which are the long-acting inhalers. And in the case of Spiriva, Spiriva contains a medication called tiotropium. Now, this medication, when we inhale it, it has a duration of action of up to 24 hours. So it means that basically it can last all day. So that effect doesn't come on as quickly as in the case of Ventolin, but it can last for a much longer time. So many patients actually find this type of inhaler very helpful, especially for COPD, because they can take it once a day and it can keep their breathing airways sort of open for longer, so they breathe better, their symptoms improve, they get less tired when they have to do some work, they have to walk around. So many patients find it very, very helpful. Now then we have Symbicort. Symbicort is another type of inhaler that is a combination inhaler. So this one contains one of these long-acting bronchodilators, but also a very low dose of corticosteroid, which we inhale. So the corticosteroid is there to generally control inflammation in the airways. Now, in the case of COPD, Symbicort is not usually the first line treatment, but it's given in situations when the COPD flares up quite often, because there may be some inflammation that we're trying to control with the Symbicort. And then obviously that other bronchodilator medication that is combined with the corticosteroid in this Symbicort inhaler. There are others similar to Symbicort as well. It doesn't have to be this one. What they do is basically they open up the airways a bit, control the inflammation, and then we add the Spiriva on top to try to get more effect and open the airway up as much as possible. So this is what we call triple therapy, when we use a steroid and two different classes of bronchodilators, right? So this is basically one way of achieving triple therapy, and that's the maximal sort of dilation treatment we can give through inhalers. Now, nowadays, if you are unable to tolerate, for example, Spiriva specifically, I would say talk to your doctor, because there are options to have this triple therapy in one inhaler now. If you're struggling with the devices, if you're worried about, too many of them, you may talk to your doctor about using different inhalers. And I'm saying that because sometimes, like it's described in this comment, you may have situations when actually you may not actually get a lot of relief from one of the inhalers, or actually you might have a reaction to the inhaler itself. Now that's extremely rare. So I wouldn't say that's the first thing I would think about, especially in this case. If someone starts off being terrified of using inhalers, I can probably predict and feel that they will struggle a little bit with inhaler technique, with getting the inhaler to go deep inside the lungs. There will be a lot of issues around that. So I think trying to understand that inhalers are there actually to help is very, very important. And understanding that inhalers are actually safer than a tablet is also very important. So I know that sometimes the breathing may go worse with some of the inhalers, but in that case, I think the only solution is to actually go talk to your doctor and just tell them very honestly, look, I don't think I feel well with this inhaler. Is there anything else I can try? And in most cases, in today's world, because we have so many options of inhalers, I'm pretty sure they can find something that could be useful for you. And I think that's all you need, just a new consultation to talk to your doctor, find the right inhaler for you. I don't think there is such a thing as the best inhaler. It's simply a case of finding the right inhaler for your case. So in COPD, like I said, the inhalers will help with symptoms a lot. They may not stop COPD. So I think it's more to do with stopping smoking, exposures to other things in the environment, but inhalers will help you sort of be able to do more. So in that case, it can help control the disease a little bit better. But anyway, this other thing that I would like to touch upon before concluding the video is this thing, because the doctor expects me to take it. My husband convinced me to take it. I think it's a question of you personally knowing what you want and what you need, because many people may have various thoughts. And I'm pretty sure that your doctor and the husband and, a friend may want you to be well. They want you to feel well. But sometimes you need to find the treatment that actually makes you feel well. Even though everyone else has their best intentions, at the end of the day, it's your body. So you need to try to find out what works for you and have awareness of your own body and your own reactions to medications. I think that's very, very important. And try to get over the fear, because if you are terrified, there is something called nocebo effect. So it's the opposite of placebo effect. So the placebo effect is when we are convinced that if we take this medication specifically, it will give us a benefit. And sometimes you may be taking a sugar tablet and it has no pharmacological effect, but you still feel some effect because you believe it will give you relief. Now, the opposite is true. If you feel that this medication, this inhaler will make you feel worse and you're terrified of taking it, your body will actually create that and it will be less effective. And the placebo/nocebo effect has been shown to contribute to about 30% of the actual effect of the medication. So actually believing that the treatment will help you helps you somehow. So I just wanted to say that before I concluded the video, because it's important really psychologically to deal with these sort of issues in COPD. And COPD is notoriously a very difficult condition to treat for the fact that a lot of people with COPD, because they are breathless, all the time, they struggle with a lot of anxiety and depression that's induced by this breathlessness, because they don't feel they can do as much as they were used to, and they have these mixed feelings of guilt, depression, anxiety. They want to be out there with people, they want to help, they want to be involved in social events and things like that, but they're struggling, and they need to carry these inhalers around. So I understand that, but that's important to acknowledge and to seek help for that specifically. That has nothing to do with the airways, but having a mind that is set on being healthy is very, very important. So if you want to be healthy, try to seek health through medication, through therapy, through discussions with support groups, through discussions with your friends, your family, your doctor, anyone who is willing to help and listen. So I hope this video was helpful to you, and I hope I've given you at least some encouragement to at least go seek medical attention and advice wherever you are in the world. I'm sure there is someone who is willing to help. Thank you very much for watching, and I hope to see you in future videos. All the best. Good health.